As a nursing student, I was privileged to undertake placement with many dedicated registered nurses across a number of nursing specialties. Reflection is an opportunity to look back upon an experience, understand what has happened, and then move on to become a better practitioner. This can be at times confronting and requires courage and open-mindedness. There are many memorable scenarios where I have observed positive role modelling by a registered nurse that improved patient outcomes and helped further develop my nursing knowledge. One thing that has stayed with me is from my placement in palliative care, and I continue to use this in my nursing practice today. When providing care to patients nearing the end of life, my preceptor encouraged me to talk to them during nursing cares, described the importance of playing music for them, and reminded me to turn their pillows over. It was the act of turning the patient's pillows over that has stayed with me. It seems like such a small thing, but when I reflect on my preceptor performing these nursing cares, she showed respect and dignity and ensured the patient's comfort. She treated the person with respect by demonstrating the NSQHS standards for partnering with consumers and providing a person-centred approach. She considered them as an individual and not just a condition to be treated. It was evident to me that her practice had developed through her own reflection on experiences, her knowledge, her actions, feelings and beliefs. Sharing these experiences and knowledge with me helped foster a culture of safety and learning that supports person-centred care. She also put into practice standards 2 and 3 of the Registered Nurse Standards for Practice. To understand why this seemingly simple nursing task had such a profound impact on me and how it continued to shape my nursing practice, I engaged the Gibbs reflective cycle to help me understand. I asked myself why I considered my preceptor as having exhibited positive role modelling behaviour and linked this learning with the experience. Gibbs' reflective cycle has 6 stages: describing the experience, considering the feelings it created, evaluating what worked and what didn't, analysing the experience, and drawing a conclusion before developing a plan for action. The first stage of the Gibbs reflective cycle requires being able to describe the experience. During my placement in palliative care, I was performing nursing cares for a patient near the end of life with my preceptor when she lifted the patient's head and turned the pillow over before placing the patient's head down. The second stage of reflection is to consider the feelings that you experienced. For me, seeing my preceptor perform this simple task of turning the pillow filled me with the greatest respect. She just demonstrated dignity and care for the patient in a way that was respectful and person-centred. Why did I feel like this? Because it had not occurred to me to perform this simple task, and I was made aware of deficits in my nursing knowledge. By taking a systematic approach to reflection, I'm able to evaluate and determine the merit and significance of outcomes and reflect on why I did not think to turn over the pillow for the patient. Even though I understood the importance of repositioning a patient for blood flow, avoiding pressure injuries and minimising patient discomfort. Despite understanding the NSQHS Comprehensive Care Standard, had I not seen this simple task performed, I would not have included it in my nursing practice until my clinical experience and practice grew. Analysing the information that I collected from my reflection has also allowed me to recognise and acknowledge that I am lacking nursing knowledge and that nursing requires continued lifelong learning. I now understand the importance of seeking feedback and reviewing my nursing practice to ensure that I maintain capability for practice and fulfil my obligations to continue my professional development. Summarising the experience helps me conclude and reflect on what I have ascertained. Going forward, I have an opportunity to engage in therapeutic and professional relationships, seeking support and direction to resources to optimise health-related decisions through supervision, coordination and consultation to achieve improved health outcomes. The 6th and final stage of Gibbs' reflective cycle is to prepare an action plan that will help you prepare if you find yourself in the same situation. Melissa and Hendricks et al. Highlight the importance of developing a plan that addresses new graduate nurses' individual requirements and recognises that it is not a one-size-fits-all approach. As I transition to practice, I intend to actively seek professional and peer support to improve my nursing knowledge and practice. The Gibbs reflective cycle has been an essential tool in helping me understand how the NMBA decision-making framework and the registered nurse standards for practice impact on my overall nursing practice as I move forward. This is achieved by identifying the needs or benefits of the person receiving care, assessing whether the nursing practice is within the scope of practice, and reflecting on the nursing practice standards. These standards and frameworks consider and identify risk and ensure the competency of the person performing the task or duties. As I move forward with my nursing career, I will continue to reflect on my practice and work toward becoming a strong clinical leader and an effective nursing role model, upholding the code of conduct for nurses. Clinical leaders follow their values and beliefs, are approachable, and provide higher service levels to their patients. Healthcare is a dynamic and fast-paced environment that requires adaptability, resilience, flexibility, and continuous learning, and is well suited to the transformational theory of leadership. Transformational leaders motivate individuals by appealing to their desire to demonstrate higher moral values and integrity in their nursing practice. They are good communicators, authentic and trustworthy. They have the courage to take on challenges, show resilience in the face of adversity, understand the emotions of others and are empathetic to their challenges and not afraid to be seen as vulnerable. As a registered nurse, I will practice within the NBA Code of Practice legally, safely, effectively and collaboratively. I will act with dignity and promote health and well-being. I will lead by example, encourage others to use their strengths, and never forget the importance or impact that something as simple as turning a pillow over can have on a patient or a fellow nurse.